Heart disease is the #1 killer in the world, claiming more lives than cancer and all other diseases combined. But here's the shocking part: many people don't even know they have it until it's too late. In fact, nearly 50% of people who suffer from heart failure experience no noticeable symptoms until their condition is already advanced. That means by the time you feel the signs, it could already be too late to prevent serious damage. What's even more surprising? Heart disease doesn't always show up with chest pain. The symptoms can be sneaky and subtle, showing up in ways you might never expect. Things like feeling unusually tired, getting short of breath after simple activities, or even experiencing jaw pain could be early warnings. In this video, we're diving into 6 hidden signs of heart disease that you can't afford to ignore. These early red flags often go unnoticed, but if you catch them in time, you could save your own life. Stay tuned as we uncover these surprising symptoms and show you what to do if you notice them. It might just be the most important thing you do for your health today. Chapter 1: The Silent Breath. When your shortness of breath isn't just fatigue, have you ever found yourself out of breath after climbing a few flights of stairs? You might think it's just because you're out of shape. But sometimes, it's more than that. Shortness of breath can be an early warning sign of heart disease, particularly heart failure. When the heart isn't pumping effectively, it can't circulate enough oxygen-rich blood, leaving you gasping for air. It's not always obvious at first, so don't ignore it. A study by the American Heart Association found that nearly half of people with heart failure report unexplained breathlessness long before they were diagnosed. It's important to recognize that shortness of breath often happens without any chest pain. In fact, some people might just feel a little winded or out of breath, thinking it's nothing more than fatigue. But over time, this can worsen. You may start noticing it when you're doing everyday tasks, like walking to your car or even talking. It's your body's way of signaling that something isn't quite right. Don't wait for severe symptoms to appear. Experts recommend seeking help if breathlessness is accompanied by fatigue or dizziness. It could mean your heart is struggling to pump blood properly, a condition called heart failure with preserved ejection fraction, HFpEF. This form of heart disease affects more women than men and often goes unnoticed for years. One simple strategy is to monitor how you feel when you're active versus at rest. Keep track of any unusual breathlessness. Regular exercise can help manage this. In fact, studies show that just 30 minutes of moderate exercise 5 days a week can improve heart function and lung capacity. But if shortness of breath is happening often, it's time to get it checked out. Heart disease doesn't always scream for attention. Sometimes, it whispers through the subtle signs your body gives you. Chapter 2: Cold Hands, Cold Feet. Your circulation could be trying to tell you something. Do your hands and feet feel cold, even when the weather's warm? It's more than just uncomfortable, it could be a red flag for heart disease. When your heart isn't pumping blood efficiently, it affects circulation, especially in your extremities. Poor circulation is often an overlooked early sign that your heart isn't doing its job properly. According to the National Heart, Lung, and Blood Institute, poor circulation is linked to conditions like coronary artery disease and peripheral artery disease, PAD. You might be surprised to learn that cold hands and feet are one of the earliest signs of PAD, a condition where the arteries become narrowed or blocked, slowing blood flow. It's easy to dismiss these symptoms as just cold weather, but if they happen regularly, they could point to an underlying heart issue. A study from the Cleveland Clinic found that PAD affects 8 to 12 million Americans, and many don't even realize they have it. Here's an interesting fact: women are more likely to experience cold hands and feet due to hormonal changes, especially around menopause. Blood flow to extremities can be reduced, which is why those hot flashes might feel even colder than usual. So if you're feeling chillier than your peers, consider this an opportunity to talk to your doctor. Don't just shrug it off as normal. One way to improve circulation is to stay active. Regular exercise, particularly walking, can stimulate blood flow and keep your heart in better shape. Additionally, elevating your legs at night can help blood circulation while you sleep. But if you notice that your extremities are still consistently cold, it's a good idea to have your heart checked. Cold hands and feet aren't always just a seasonal issue, they might be your body's first warning sign. Chapter 3: Your jaw pain could be a heart alert. The strange link between headaches and heart trouble. Jaw pain might seem like something you'd chalk up to stress or even a dental problem, but did you know it could be linked to heart disease? This is especially true for women. According to the Mayo Clinic, some people experience referred pain in the jaw or teeth before a heart attack. In fact, jaw pain is one of the lesser known, but significant, symptoms of a heart attack. It's often described as a dull, aching pain that can radiate to the neck, shoulders, and even the back. Interestingly, heart attack symptoms can vary between men and women. While chest pain is the most common symptom for men, women often experience subtler signs like nausea, fatigue, and jaw pain. It's thought that this happens because of the way pain is transmitted through the body's nervous system. The heart and jaw share similar nerve pathways, which is why pain from a struggling heart can manifest in your jaw. A study published in the Journal of the American Medical Association found that nearly 10% of people having a heart attack experienced jaw pain as one of their first symptoms. Yet, many dismissed it, thinking it was due to teeth problems or tension. In some cases, the pain may be mild and mistaken for a toothache, but it can also come with other symptoms like chest discomfort, nausea, or lightheadedness. So, what should you do if you experience jaw pain along with these other symptoms? Don't wait it out. The sooner you act, the better your chances of recovery. If you've been ignoring your jaw pain thinking it's nothing serious, it's time to see a healthcare provider, especially if it's been happening more frequently. Taking immediate action can save your life. Don't forget to subscribe for more tips on how to keep your heart healthy and recognize the early signs of disease. Chapter 4, The Swollen Ankles Mystery. A puffy reminder of a potential heart problem. Swollen ankles and legs might seem like an annoying inconvenience, but they could be a hidden warning sign of heart disease. When your heart isn't pumping blood as it should, fluid can build up in your lower body, causing your ankles, feet, and legs to swell. This condition is called edema, and it's one of the more subtle signs that your heart needs attention. According to the American Heart Association, nearly 5.7 million Americans suffer from heart failure, and swelling in the legs is a common symptom. Edema often happens because the heart isn't pumping blood effectively enough, leading to fluid backup in your veins. Over time, this causes swelling in the feet and ankles, sometimes making it hard to walk or move comfortably. If you notice your legs feeling heavy or tight, it's worth paying attention. Experts say that swollen ankles are often a sign of heart failure, but it can also point to other conditions like kidney or liver disease. But how can you tell the difference? If the swelling is persistent and doesn't go away after a night of rest, it could be linked to heart trouble. If the swelling is accompanied by other symptoms like shortness of breath or fatigue, it's time to see a doctor. A 2018 study from the National Institutes of Health found that people with heart failure often experience leg swelling as an early symptom, before the more obvious signs like chest pain appear. A simple strategy to help manage swollen ankles is to elevate your legs above heart level. This helps fluid return to your upper body. Another tip is to reduce your sodium intake. Too much salt can worsen fluid retention, making swelling worse. Staying active is also important, as regular movement helps improve blood circulation. If you experience swelling regularly, don't ignore it. Seeing a doctor early can help prevent further complications. Chapter 5, Chest Tightness that feels normal. When heart symptoms aren't obvious, if you've ever felt tightness in your chest after a long day or stressful situation, you're not alone. Many people experience this sensation and brush it off as stress or indigestion. But sometimes, chest tightness isn't just normal. It could be a warning sign of heart disease. In fact, chest discomfort is one of the most commonly ignored symptoms of heart problems, particularly for women. Studies show that women are more likely than men to experience non-chest pain symptoms, like tightness or pressure, when experiencing a heart attack. The tricky part about chest tightness is that it's easy to mistake for something minor, especially when it doesn't happen every day. You might feel a vague pressure, tightness, or squeezing sensation in your chest and think, it's just stress. But heart disease doesn't always come with dramatic chest pain like we see in movies. Sometimes, it's just a subtle discomfort that can be ignored until it's too late. A report from the American Heart Association notes that more than 50% of women who experience a heart attack have no prior chest pain or traditional symptoms. This means many women miss the early signs of heart trouble. It's important to pay attention to your body's signals, especially when the tightness is persistent or occurs with other symptoms like dizziness, nausea, or shortness of breath. The strategy here is to monitor how often and when the tightness occurs. If you feel it during physical activity or when you're at rest, it's time to talk to a healthcare professional. They can help identify whether it's heart-related or something else. Another tip is to reduce stress through meditation or deep breathing exercises, as stress is a known trigger for chest discomfort. But never take chest tightness lightly, especially if it becomes more frequent. Chapter 6, The Fatigue You Can't Shake. When exhaustion is a red flag, not just a busy life, we've all been there, feeling tired after a long day, or even waking up feeling drained. But when exhaustion becomes a constant companion, it could be a sign of something more serious, like heart disease. Fatigue is one of the most common and most overlooked symptoms of heart trouble. It's easy to brush it off as just having a busy lifestyle or not getting enough sleep. But chronic fatigue could be an early warning sign that your heart is struggling to keep up. A study published in the Journal of the American College of Cardiology found that 25% of people diagnosed with heart failure cited fatigue as their first symptom. This feeling of tiredness often doesn't improve with rest, which is a key indicator that it's not just the result of a busy day or lack of sleep. As heart disease progresses, the heart's ability to pump blood and oxygen to the muscles decreases, leaving you feeling constantly drained. If you find yourself struggling to keep up with your usual daily tasks or feeling unusually tired even after a full night's sleep, it could be time to investigate. Fatigue can be especially alarming if it's paired with other subtle signs of heart disease, like shortness of breath or swelling in your legs. This type of fatigue can sneak up on you slowly, and many people don't realize it's linked to heart issues until it's too late. One strategy to combat this is to listen to your body. If you find yourself constantly tired and you can't seem to shake it, don't just push through. Make sure to get regular exercise and maintain a heart-healthy diet, as both can boost energy levels. A balanced routine of physical activity and rest is key. It's also helpful to track how you feel over time. If you notice that the fatigue is worsening or not improving, consult a healthcare provider. Don't ignore the signs that your body is sending you. Heart disease doesn't always make a grand entrance. Often, it comes in the form of small, subtle signs like fatigue, chest tightness, or swelling. But by paying attention to your body and taking action early, you can manage these symptoms before they turn into bigger problems. Taking proactive steps, like maintaining a healthy lifestyle, reducing stress, and staying active, can go a long way in preventing heart disease. If you notice these signs, remember, it's better to be cautious and check in with your doctor than to let a small issue become a life-threatening one. Make sure to subscribe for more health tips and insights to keep your heart in top shape.